morning and welcome to the program Perspectives this morning on Invicta 98.9. And here today we're still staying in Kaduna State. Of course, giving it a wider audience of the Nigerian entity. And it's all about COVID-19, where we are with it, Nigeria and back home in Kaduna State. Yes, we are all, enjoying the relaxation of the lockdown. So people are going about doing their businesses. And of course, we're seeing, smiling faces all over the place. And, we're going about it in such a way that we are, keeping our guards off, so to say. And we know that government has said that in spite of the relaxation of the lockdown, we must still observe all the measures that have been put in place to get rid and get coronavirus or COVID-19 out of our state and out of the country. And so where are we with coronavirus? And are we doing all that is required of us to do in order to get rid of this virus, this disease that is taking its toll on the economy and every sector of our facets of life? And this morning, we're talking about what is happening in Kaduna State. We're still getting rising cases of coronavirus. And let's talk about it and see where we are in Kaduna State. Dr. Oyefabi Adegbenga Moses is my guest. Adegbenga Moses is my guest this morning. He is a consultant public health physician and senior lecturer, Kaduna State University. He is also the team lead of Infectious Disease Control Center, Kaduna. Dr. Oyefabi, good morning. Glad to have you here with us.
Good morning, Mr. Twin.
Yes. Thank you. Yes, and let's go back, take an overview of the situation that we have on ground. NACA opened up by saying that citizens of the state are happy, going about their businesses. And again, it's like some people would say, we're back to normal. But the situation we have on ground is that we are having a new normal. And so people saying that we're going back to what we used to do is like saying, letting off their guards on how to, curb this disease. And so with what you're seeing, a general overview about the situation we have with us today.
Thank you very much, Mr. Twin. Let me start by talking about coronavirus situation in Nigeria globally and coming back home to Kaduna State. If you remember vividly, the first case of coronavirus in Nigeria was on 27th of February. An Italian man who worked in Nigeria, who traveled to Milan in this country, came back to the country with the COVID on 25th, and by 27th, he was diagnosed as the first confirmed case of coronavirus in Lagos, via Ogun State in Nigeria. From that time, over a period of 4 months, Nigeria have had a lot of cases, and as of today, we have 16,658 cases, confirmed cases. But God has helped us. You know that we have discharged about 5,349 cases in this country. From that time, death due to coronavirus has been 424 deaths in the country. But this that we have seen in Nigeria, when you compare what is happening in the global picture, you will see that we have been greatly helped in this country. Globally, there were 7,823 cases, 823,000, then 289 cases. That's more than 7 million cases globally, very close to 8 million globally. And global deaths has also been very high, about 201,000 deaths globally. So when you look at what has happened in Nigeria, you find that the situation in Nigeria it has not been very bad when you compare it with the global picture. And then coming back to Kaduna State, as of today, we have 446 cases, confirmed cases in the state, and we have discharged 269 of those cases. So actively, we just have about 165 people who are active. When we say active, that means these people are still on admission. And the good thing is that majority of these people are asymptomatic. What I mean is that they don't have any serious symptoms. They are just like any other person, but we need to isolate them from the general populace because of the transmissibility of the infection. People can quickly contract the infection via close contact, person-to-person transmission. So we need to separate these people, that will isolate them from others. They are in isolation for some period of time. They get well on our medications, on our management. Then we discharge them. So we have 165 of such cases in our center now. As I have said, we have centers, 2 centers in Kaduna Metropolis. Then we have a center in Abuja in Zaria that manages these cases of coronavirus. And what you have seen so far in the state, because some people will be asking, is coronavirus, is there any case of coronavirus in Kaduna State? Even people who are health workers have asked me. A matron in the hospital have asked me, is it real? I said, no, come to my center. Come to our centers, our isolation center. I will show you the cases, since you are a matron. So we have situations like that people are actually wondering if it is real. The truth is that it is real. It is real. 12 people have died of COVID-19 in the state. I have told you we have just about 446 cases. I say just because compared to the global picture. And there's something we call case fatality rate in Kaduna State, 12.7%. Low. Low death rate. That's what I mean by that. Then when you look at the male to female ratio, because when we are doing analysis of those who have been affected, you want to see, is it more of male or more of female? You find that 68% of those who have been affected so far are male, and 31.2%, just about half of that are female. Then the younger age group are the most people that are mostly affected of these diseases, and it's understandable. These are the working age group. These are the people that goes everywhere. So you see age 11 to 39 are mostly affected. And you look at this lower age, you remember that in Kaduna State, there was a time we have upsurge of the Almajiris that came from other states to Kaduna. And they actually added to the number of cases in Kaduna. The good thing now today is that we have discharged all of them. All the Almajiris have been discharged. And government is taking adequate care of their education and other things. Most cases have been from some selected local governments. I don't know, in the state.
Well, Doctor, you painted a picture that confirmed cases.
Yeah.
This would be said to be reported cases.
Yes.
That government or the health personnel can confirm that
yes.
They are here with us.
Yes.
But we are in a society where just how do we know how confirmed, the cases might be when you go about suburbs, the hinterland, and Kaduna as a whole.
Okay.
How do we get reported cases where in a situation where stigmatization has made people not to even want to come out, and of course discrimination of victims.
Yes.
So how do we get the real figure, the real figure of what is really
How do you know that
how
it is
do we know?
coronavirus?
Yes.
Thank you very much. Let me start by educating us to say the word corona means crown. The Latin word, it means crown. And that name was given to this virus because of the way the virus appears on what we call electron microscopy. It appears, there's some protein structure appearing like a crown. That's how it gets its name. Then there are some subtypes of this virus. We have what we call the severe acute respiratory syndrome, SARS-CoV-1. Then we have the Middle East respiratory syndrome. Then we have this one they call it novel virus, in the sense that it has never been there before. It appeared first on 31st of December 2019. That's why you see people calling it nCoV-19, a new virus towards the end of the year 2019. That's how I get that name. Then when you talk about the symptom, how does this present? We have what we call the symptoms and the signs of the infection. Now, what does the ordinary people say? To say, does this person is a suspected case? Do we need to call the attention of the state Ministry of Health people to come and or the NCDC to come and take this patient and advise them? One, the symptoms are just normal, like the normal symptoms that we are used to in the society. You talk about people having cough cough, difficulty in breathing, fever. So if somebody have cough or difficulty in breathing or fever, you know, I didn't say cough, difficulty in breathing and fever. They cough or say any of these three surface. But that is not enough. Again, we have to, even when we say fever, we have to check the temperature. We have our instruments for checking temperature. You've seen people going about maybe at some point of interest. They will carry an infrared thermometer. There's a thermometer. They will try to check the temperature. So they will measure the temperature to see if it's above a particular degree. In the hospital, we say greater or equal to 38 degrees Celsius. But just for a normal person, say he has fever, he has cough, he has difficulty in breathing. Then you now tie that with the history of exposure. That's what we call the history of exposure. And when we say history of exposure in this case, we are talking about exposure to either a confirmed case. Somebody have this history of cough or difficulty in breathing or fever. Does this person have a contact with a confirmed case? If that is the case, then this is a suspected case. You get the point? Or the person had traveled to before when this thing started, they say travel to China. But as time goes on, it was being modified. Now the history of traveling is even now played very down now, because virtually every state in the country, except some few states that have are not willing to report cases of COVID, virtually every state have been affected. So the history of being in a place where there's an ongoing transmission of COVID, like our state now, there's ongoing transmission of COVID. Kano, Lagos, Abuja, all those places, ongoing transmission of COVID. Or if somebody had been to or work in a healthcare facility, like I'm here now, I'm from the isolation center. So healthcare workers who work in those centers, who have symptoms I've told you before, fever, cough, or difficulty in breathing, and they are working in those centers, or they had been in those centers. So when you have this history of, you have symptom, you tie with exposure, then you say this person is a suspected case. Suspected case. Just like when we can compare with when somebody commits crime and say this is a suspect. Is this a suspect? Of course, COVID is not a criminal or something. I'm just talking of to make people to understand what we're talking about. The police will say this is a suspected case. We have not said this is a criminal, but this is a suspected case. So in this case, this is a suspected case. Now, a suspected case, now the attention of as we have already been said, that COVID is not a facility patient. People should understand this. When I say facility, I mean it's not a patient to carry to that be managed in a I'll just put the patient in my private clinic and start managing the patient, or you put the patient in the general hospital and start managing the patient. No. If somebody have COVID, you take the patient to the hospital, any hospital. In that place, the healthcare worker we follow this, what I've just told you now. They call it case definition. With this case definition, the person will say this is the confirmed case. This is a suspected case. And when the healthcare worker made that diagnosis, the healthcare worker will now, there's what they call SIN. You try to, they will separate the person from someone is suspected, they will isolate the person and notify the appropriate authority. In this case, the appropriate authority to be notified is the state epidemiologist in the State Ministry of Health. They call me. We have a case here. It's a suspected case of COVID. Please, can you help us? So the surveillance team will come from the ministry, and they will carry out some investigation. They will examine the patient. Then they will say, this is a suspected case. You can see how it goes. In the community, this person was sick. He has some history of traveling. Or history of contact, then they brought him to the hospital. In the hospital, the healthcare worker say, oh, this is a suspected case. They now notify the ministry. The ministry people, through the state epidemiologist office, they come with the surveillance team to come and take the patient. They examine the patient. And if the patient is actually a confirmed, a suspected case, the next thing is to now decide on the next line of management of the patient. The patient can be asked to self-isolate at home, and samples will be taken from that patient. And that sample is what will be used to diagnose and confirm that this is a case of nCovid. So self-isolation can be done at home until when the results of the test comes out. Then they will now say, okay, this person is confirmed. Of course, a confirmed case we manage at the facility, at our isolation center. Few cases based on the national guideline can be managed on home arrangement. If that kind of home or house is fit into the what we call the checklist given by the NCDC, a patient can be managed like that, either at home or in the facility, at the isolation center. So this is how it goes.
Something is coming up here, and,
yes,
and this is about isolation. When
yes,
you isolate suspected patients.
Yes, sir.
And they go through health management or medical management.
Yeah.
And in the end, it can be determined that such people can go back home because they are free of the virus now.
Yes.
One of the things that people ask is what treatment are meted out? What treatment do these patients, go through, and makes them get the record of yes, you've been isolated.
You manage, you're not okay.
You're now okay. Yes.
Okay. You see, this disease, if we understand me in simple language, we have clinical. You make your clinical assessment of the patient, then the confirmation that the patient is positive is from our laboratory results. So when somebody is positive, as I've said, we manage the patient mostly in the isolation center. Mostly. Few, based on NCDC criteria, can be managed at home. Very few. Now, our management protocol, we may not come to the studio and say, okay, these are the drugs, drug A, drug B, drug C that we give, and the reason being that we have noticed that many people are abusing so many drugs. For example, I will not mention, there was a particular need for a particular drug during the week. The drug was sold before for like 15 naira, 100 naira. But recently now, you get it for about 700-800 naira because people are abusing it. So we may not say, okay, these are the drugs we give, but people know from different sources. They can say, okay, these are the drugs used at the isolation center. But me as a facility manager, I may not say. But what I will say is that we manage our drugs on basic drugs, and within some days, if a patient is complying, or if the patient has complied with those drugs, in Kaduna State, we have seen tremendous results. I mean, tremendous good outcome. Averagely, our patients stay for 5 days, and they go back home.
Yeah, doctor, because I'm asking this question because you mentioned that symptoms of cough, fever,
difficulty in breathing,
sore throat.
Yeah,
I mean, these are prior to or before COVID-19. These are health issues that one can take care, at home.
Yes.
And again, with COVID-19, we see that some traditional medicine people have come out to say, look, this is one cure that you can have for COVID-19 here.
Yes.
And so people, self-medication is also even going on with COVID-19. But again, confirming that and saying that one can rely on that. But again, orthodox medicine will tell you different.
Yes. One thing about drug in clinical medicine, we have drug trial. When you say that this drug A can cure this disease, you say no problem. Let's subject the drug to a clinical trial. And if it passes the test, then the community or the populace can use the drug. But if not, in clinical medicine, we will not use such a drug. So when you say traditional medicine, this. Okay, the question is, have this drug gone through a standard clinical trial, randomized clinical trial? So that will be the. If you remember, there was this case of a Madagascar drug coming to Nigeria. It's going through some phases of clinical trial, and if it passes the test, then people can use it, because we cannot subject our populace to danger in the name of we have found a cure. So that's how it goes. But as I have told you, fever, cough, difficulty in breathing. Now some people are having anosmia. When I mean by anosmia, I mean they have they cannot perceive smell as part of the symptom of this infection. So they are just common symptoms. But some people will even say, okay, this thing looks like malaria. Some of the drugs we are giving in isolation center are malaria drug. Some are saying these are this. Okay, but what we know, COVID is different from malaria. COVID is different from pneumonia, in common community acquired pneumonia. Several people may have community acquired pneumonia. You will think it's COVID until the test is done and they are differentiated. But whatever it is, we may not say this is a particular drug that cure COVID. But we have in Kaduna State and in different parts of the country, we have observed that when patients are managed, especially in our state here, on our management protocol, they recover. And that's why I can boldly tell you today that we have that in Kaduna State we have discharged 269 cases back to the society. They are happy. They have done majority of them have done follow up with us, and they are very okay, no problem. And I've told you, total cases in Kaduna was just in all this time in Kaduna it was 446 compared with the total cases in the country. Thank you.
Okay. Yeah. All right. But this time, I want to, bring in the government of Kaduna State into all of these.
Yes,
that how we've been able to manage COVID-19. Again, the proactiveness of the government of the state.
Honestly, if we are not playing politics, we should give kudos to the Kaduna State Governor, Malam Nasir Erfan. He has shown that he's a leader at this time. He has shown us that he's a leader, and he has shown us that he's educated, and he has people around him who are competent. In this state, we have competent clinicians, we have competent public health physicians, and we are working in this state on 9 pillars. The Kaduna State is using 9 pillars to respond to the epidemic. And these pillars we call them epidemiology and surveillance pillar, the laboratory service pillar, the point of entry, infection prevention control, case management where I am, the risk communication, logistics and supply, coordination and research. And this is being powered by the Kaduna State government. If you remember, our governor goes about with the point of entry. Yeah, you see him going about. So sometimes I say, is it that Mr. Governor himself is part of the is part of our rapid response. He's part of our rapid response team in that respect. So the state has led many states in the northern Nigeria as far as the fight against COVID-19 is concerned. Many of the neighboring states are coming to learn from us, and this has reflected in the outcome of the cases that we have managed in this state.
Okay, it's perspectives this morning, and we're talking about Kaduna State, COVID-19, where we are with it, and of course compliance on measures put in place to get rid of this disease in the state. And sharing thoughts with me this morning, Dr. Oyefabi Adegbenga Moses, a consultant public health physician and senior lecturer, Kaduna State University. He's also the team lead of Infectious
Disease
Control Center, Kaduna. We'll be back with you after this break.
Invicta FM. Invicta FM.
Welcome back. This is the program Perspectives this morning, and staying in the state and the situation that we have here in COVID-19 and how we're keeping ourselves safe. Dr. Oyefabi Adegbenga Moses, consultant public health physician and senior lecturer at the State University, team lead, Infectious Disease Control Center, Kaduna. sharing thoughts with us on the situation so far. Doctor,
Yes, sir.
yes, relaxation of the of the lockdown. Everyone's so happy going about doing their businesses, and of course, we're having smiling faces all over the place. But again, these measures that are put in place are for the safety of citizens. Social distancing, sneezing on our bent elbows, and of course, staying home, and of course, also on using the face mask, all of that in place. But looking at it since we had the lockdown, relaxed, how what is for you the compliant level of citizens on these measures put in place? Are we totally relaxed now, or we just off our guards with how we're going about it?
Thank you, Mr. Twain. Let's educate ourselves a bit and say that the lockdown is scientific. COVID is transmitted, person-to-person transmission. Person, you come in contact with people. That's how it's transmitted. And we call it droplet infection. Droplet infection. What that means is that when the individual cough or sneeze or talk, the product from the individual, it gets into the next person through any of the openings into the next person. The person can be infected with the disease. Now, if you try to prevent that person-to-person closeness, there will not be transmission of COVID infection. And that was brought the idea of social distancing. And social distancing in this case will at least 1 meter from the next person, arm length from the next person. At least it can be 2 meters, be at least 1 meter from the next person. When you are seated somewhere, let there be gap between person A and person B. And let people as much as possible stay at home. They should not go to places, to social centers, to prevent or reduce interactions. When there are less interactions among people, there will be less transmission of the infection. And this is what brought about the idea of lockdown. Lockdown the state so that there is no interstate travel. So that people who are coming from a high-risk state will not come and carry the infection and bring it to a state where the infection is not there before, or is the prevalence is less. That's the idea. And it has worked in this country. If you look at it, it has helped us tremendously. Compare the Nigerian figure with the global figure. I've told you about 7 million cases in the world, close to 8 million, and Nigeria is talking 5,000 over 16,000 cases, 16,000 plus cases. So this has helped us. Now, when government sees that, look, you cannot balance keeping people at home with the socio-economic situation of the country, there's a need for people to move out. People are already agitating. People are not working. Money is not coming. A lot of issues are arising. Then government is the care for our health. And when you talk of health, it's not just taking drugs and getting well. It's a state of physical, mental, and social well-being. So the government say, excuse me, let's begin to relax this. So that's what brought the idea of relaxing the lockdown. And now people can go about their duties to some extent. But to keep ourselves safe from the infection, we must still follow the guideline. Though we are going about, we must make sure that we maintain our social distancing. We put the face mask. When need arises, we wash our hand. But if you go around this town now, or the city, into the metropolis, you find that majority of people are not complying. People are just going about their normal businesses. This is not too good for us. There's a need for compliance, so that the good picture we're beginning to have. If you look at the Kaduna State, there's what they call the epidemic curve. The thing is beginning to come down. So for us to maintain it, and the thing will gradually leave the state or leave the country, there's a need for the citizen to comply more than what we are doing now. Thank you.
Okay. And again, non-compliance and rising cases of it, as we're saying now, it may get to a situation where that's not what we want, but we reverse back and go back to the lockdown.
Yes, if there's a need to go back to lockdown, of course, there is, like in Kaduna State and some other states, every day, that's what we call the Emergency Operation Center, where the major stakeholders in the state, in public health, they meet together with policymakers. They examine the situation every day. What is the compliance? What are the cases? How many cases do we have? How many tests have we done? They examine the COVID state every day in the state. And every day the decision is made. So people are watching, policymakers are watching, public health people are watching, and every day report is being given. So if we discover that the people are not complying and the cases are rising, the government may take a decision. But I pray it will not go to that level again.
Yeah, okay. We are at a new normal now.
Yes, sir.
Our lives may not be the same since COVID-19 came.
Yes, sir.
And so, because we are in a new normal, what we're getting from government is that the children and the old,
yes, sir,
and should avoid places where where we have a gathering of people and all of that.
Yes.
Now, even at our places of worship, that's also going on.
Yes, sir.
So when you look at old people and children, what are the risk involvement for COVID-19 here?
Thank you very much. We'll begin to do some analysis now. Very soon we'll come out some reports. But from our observation as managers of the cases in Kaduna, the few deaths that we have had are people that have what we call comorbid condition. I will explain. When I say comorbid, I mean these people have some other underlying problems apart from COVID. They have what they call chronic diseases. They have some other diseases underlying that aggravates even their condition, and that leads to their death. And many of them are also old-aged people.
What's your old now? Where would we put the limit? Or
yes.
Start taking it up.
When I say old, talking of 50, 60, 70 years old. People are above 60. The people I'm talking about here, the elderly. The affectation with COVID is more severe than the younger person. So it affects at the extreme of age, because the immunity at that level is lower. Somebody who is a child and somebody who is very old, they call them extreme of age. So at that extreme of age, the body immunity to fight infection is lower than somebody who is 15 to 30. This is a young person who is agile, moving about, may have the disease, and we have many of them like that. They are asymptomatic. Because somebody is very old or very young, the likelihood of the person coming with a severe form of infection is very high. And that is why we say, and if you have looked at what is happening in the developed world, you find out that their age population is mainly at the old age because of their relatively better healthcare facilities. People live longer in those places. So, but here, you see that the people that are most affected are the young people, I've said, and we are trying to shield the people at the extreme of age, the very young, the children, and the very old, because the severe form of the infection affects this populace more than the people in the middle age group, the young and middle age group.
For COVID-19, again, there was the challenge on the health sector.
Yes.
And again, when the case of it, when Nigeria first got its first case, we were not, as prepared as one would want a country like this to be. And so it brought a challenge on the health sector that, having, the best of the health sector in the country was challenged. And so people said we were at a risk of having a high case of it than we have now. Some people put it on spirituality that God has just been kind and all of that to Nigeria. But again, going forward, the health sector, budgeting on the health sector, and what we expect, primary health care and all of that, to secondary and to tertiary. What are
Yes.
we saying here?
Yes, what we can say is that the government have tried as much as they can, and they are still making efforts. We have the President Task Force for COVID, and each state have gotten the state rapid response team for the prevention and control of the infection. In Kaduna State here, I've told you about the 9 pillars for the prevention and control of the diseases, and government, then other donors are bringing in a lot of materials, equipment. That's what they call it, personal protective equipment. That's PPEs, both for the isolation centers and for the different hospitals. Now, what are needed at the facility level, when I say facility, at the hospital level, is the ability of the doctors, the nurses, and other health workers there to be able to have access to what they will use to protect themselves against COVID. That's provision of personal protective equipment. And that has been a challenge. Government and other agencies who are also donating are helping to gradually overcome some of these challenges. It has been the COVID has been a body on our health system. If you remember, even our doctors talking of strike, talking of incentive,
Coming to that.
talking of all these things.
It's coming to that.
But gradually, you can see the figures we have. The country is overcoming COVID, and that is why we can be talking of a easing of a lockdown. Thank you.
Now, let me also place it with, share it with our health centers, private
Yeah.
health centers.
Yes.
COVID-19 too, it took its toll on private health centers.
Yes.
We saw some of them closed, and fear of coming in contact with COVID-19.
Yes.
But again, the situation where we have now, can we trust and rely on the private health centers now that we're having a clear court on the situation of COVID in Kaduna State, that private health centers can open up too, so that we do not put more burden on government health centers?
Okay, let me give some things that we have done with private practitioners in Kaduna State. I have been involved in training of private practitioners. I and my colleagues across the state, and several of them have been trained on how to screen, isolate, and notify the appropriate authority when it comes to cases of COVID-19. Now, what a private practitioner should understand, and other facilities apart from the isolation centers you understand, is that the COVID patient is not your facility or hospital patient. You cannot keep a COVID patient in your hospital without notifying the appropriate authority. You cannot admit a COVID patient in your facility and be managing the patient on your own, and you didn't notify the state ministry of it. If that is the condition and the patient is confirmed to be COVID, that hospital can be closed down. So people should understand, people who are in private practice should understand that their responsibility is to screen. We have a case definition for screening for COVID. They screen, then they should have a place, like a holding bay, to isolate the patient. Both private facility and other hospitals should have a place. It might be a secluded place in the facility where the patient that they have isolated will not be in contact with healthcare workers or with any other person who comes to the facility, patient or patient relative. As the isolation in this case, I'm not saying that they are going to manage the patient in isolation like we are doing in isolation center. Isolate the patient for some few hours or for a little time before you get the response from the ministry of health. People at the surveillance team will come and see the patient and say, okay, this is actually a suspected case and this is our line of management. So your responsibility as a private practitioner is to screen the patient, isolate the patient, and quickly notify the appropriate authority in the ministry through the office of the state epidemiologist. So that the state rapid response team, the surveillance team, can come and see the patient and evacuate the patient if there's a need. If you fail to do that, that facility can be closed down. And I think we have seen a sample in Kaduna State.
Well, again, talking about health workers, you involved too, and looking at the risk involved, and how safe you can also be with this situation, because we have it that some health workers, with family, would have come to the health centers, go back to their families, and so the risk involved in Kaduna State. How protective, are we of the health workers?
Yeah, let me say that yes, health workers are at risk, and we have few of us who have been infected, and we have managed. Quite a number of those who are infected have been discharged back to their family. So far we have a case of one healthcare worker who have died of the infection in the state. So we are at risk. We call healthcare workers high risk group, but there are ways we protect ourselves. We have the personal protective equipment. So healthcare worker must have access to these PPEs, and all patients that come to the facility as at this time must be treated with what we call the standard precaution. We must take standard precaution approach, in the sense that either the patient is COVID or not, you must make sure that you use your personal protective equipment, and that involves the face mask. If there's a need, the other PPEs are also used, like the goggles, the face shield, then the gown. But there is a procedure, there's a protocol for using of any of these personal protective equipment. So once somebody comply with the use of all these equipments, the risk of transmission of the infection is less, including the hand glove. What the government and facility managers, these medical directors need to do is to make sure that they have adequate and appropriate personal protective equipment for the healthcare worker. One, all healthcare workers are trained on infection prevention control measures, and they are seen practicing it. So with this, less infection among healthcare workers will be the case.
Okay, we'll go to the audience now. With let's get your thoughts too, and on COVID-19 in Kaduna State, and of course how government has been taking care of the measures that are put in place, and of course citizens' responsibilities too on this. But just before I do that, give out the numbers, doctor. That one can be treated. We have cases that we've seen patients been treated and discharged.
Yeah.
Can we have a situation where discharged and again, take it back, infected again, reinfected, so to say?
Okay, let me say reinfection. There's a reinfection. There's what people also are afraid of, reactivation. Now, for reinfection, it's possible in the sense that somebody had COVID, had been treated. When they are going home, we cancel them. We'll tell them what to do and what not to do. We'll tell them you are on follow-up for this number of days, number of months, and that you are now negative for COVID. Congratulations. But you should understand that COVID disease is not like measles. Measles, you get measles once, you never get it again in your life, because the measles, that infection is protective against it. Is protective. Now for COVID, that somebody has gotten, the person has recovered. We don't have cases. There are no documented cases of reactivation, and that the thing just come back on its own. But if the person get exposed again to another situation where it can be there can be infection, the person can be infected. What do I mean? Somebody with COVID who has been cured, who goes to a community where there's ongoing transmission, and the person didn't observe social distancing, is not putting his face mask, another person can come and infect him. Are you getting the point? Unlike measles, Oh, you get measles once, you never get it again. All of that thing being equal. But for COVID, there can be an infection.
Okay. All right.
If the person does not take precaution.
Okay. Okay, we come back to you. Be part of the conversation on 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. Hello, good morning.
Good morning. Good morning, Eloy.
Good morning.
Good morning, doctor.
Good morning, thank you.
Yes, I'm Kure by name. Honestly, the doctor has said it all. The question that I want to ask you about this, our clergymen, most of them are above 60. So how do we go about them? Secondly, about this infection of COVID-19. You see, the government, we're asking the government to just help us. Ordinary face mask, they cannot provide for its citizens. And some are finding it difficult to cover their nose. So what are they doing about it? Thank you very much for giving me this opportunity.
Okay. Well, doctor.
Thank you very much, Mr.
Kuri.
Mr. Kuri. Thanks for your question. You mentioned that government should provide a face mask. But let me say, Mr. Kuri, that now the citizens also should take responsibility for the prevention and control of COVID. Yes, government can provide, and I think government is also making provisions for some palliative material for the people, the populace. But individuals should also, as much as possible, protect themselves, maintain social distancing, at the same time, get your face mask. Don't wait for government to give you a face mask before you have one. Thank God, you see people around now doing this cloth face mask. So these are what somebody can get and use. You don't need to wait for government to come and give you donation of face masks before you get one for yourself. So we are talking of people taking responsibility for protecting themselves. So if government comes, that's an addition.
He also talked about with our clergy and clerics and all of that above the age of 50 and with their congregation.
Yes, the clergymen, there's a need for continuous engagement, public health practitioners, government and policymakers with the clergymen, so that they can observe the standard protocol for infection prevention control guideline as given by the state and the NCDC. And there's a need for enforcement of that laws and regulations for opening churches and mosques, so that we can curtail or control this pandemic. In churches or in mosques, there's a need for social distancing. There should be gap between person A and person B, so that there will be no. And I think there's a guideline for this in the state. So what the government need to do is to make sure that people does this. And if a particular group or a particular organization is not doing this, they should be called to question why they are not doing that.
Still with your calls? Hello, good morning.
Hello, good morning, Mr. Perry.
Good morning.
And good morning, Doctor.
Good morning, thank you.
Yes, my name is Mr. Fresh.
Okay.
We're still on the issue of the churches. I have observed that in the past, even now, because there are sources of getting income.
Yes,
sir. So what do we do with the issue of offering tithe? That is one. And what do we do about the issue of alms giving? There are people that believe in that. And again, it's not everybody that is mobile. So we do enter commercial vehicles. We exchange money. We give conductor and he gives us change. So what do we do with all this issue of exchanges and offerings, alms giving, and so on? That is one part. And the other issue is that when you go to the bank, I'm still on the issue of the money. You take either your check or your whatever with cash. and also the issue of using ATM machine and the card. So, what do
Okay.
we do with all of these things?
All right, Mr.
Because,
Fresh.
thank
Okay,
you.
we thank you on that. All right. I'm a little bit, but doctor, let me just bring it to you.
Just briefly, let me say for churches, exchange of money, tithe, offering, what we need to do is to maintain hand hygiene. There must be provision for washing of hands in churches, in mosques, in banks, so that when people exchange money, they go and sanitize their hand with soap, water, or with their sanitizers. This is what needs to be done. Then for the issue of buses, there should be social distancing, even in buses. But it cannot be business as usual. They cannot be this overcrowded carriage of passenger cannot work now. There should be distancing between one passenger and the other, and a law enforcement agency should help us to enforce that.
Okay. Okay, still can take one or two calls. Okay. And hello, good morning.
Hello, good morning.
Good morning.
Thank you very much. Mr. General, good morning. My name is Musa Bala.
Okay.
I want to greet the doctor and I want to ask this question, please. We just realized that there's another wave of infection currently going on now. As I'm talking to you, China has started locking down and measures are being taken. What are the Nigerian authority and Kaduna State authority are doing maybe to forestall that infection for the second wave or a new dimension to COVID-19? May God continue to protect us. Oh, good morning to you.
Okay, Musa Bala, thank you.
Thank you very much, Musa. What the state government is doing, we have said it earlier, is to educate the populace to observe the rules of social distancing, use of face mask, and other prevention control measures when following this easing of the lockdown. If we don't comply with these regulations, you may have the situation that you describe in China, but we pray that will not be the condition. So we hoping that the populace will comply with the rules and regulations given by government in this easing of the lockdown, so that what you say in China will not be our experience in Kaduna State or in Nigeria.
Okay, your last line, doctor.
My last line is that now we should observe infection prevention control measures as given by the national guideline and the state government for prevention of COVID, just as we have been saying in this presentation. If we do that, social distancing, use of face mask, hand hygiene, cough etiquette, there's possibility of we overcoming completely this infection in the state and the nation. Thank you.
And that will just be about the size of it on Perspectives today. Been talking with Dr. Oyefabi Adegbenga Moses, consultant public health physician and senior lecturer at Kaduna State University. Also the team lead, Infectious Diseases Control Center, Kaduna. Thank you, Dr. Oyefabi.
Thank you, sir.
All right. We'll come back with Perspectives tomorrow. I'd like to thank Prince for connecting us with the people today. And, of course, Wisdom putting us in the pictures. Good morning.
Victor FM.